Oh, geez, sorry.
So let me see your reflective belt. Let me see your reflective belt. So let me see your reflective belt. You better put it on, better put it on. You better put it on, better put it on. You better put it on, better put it on. So
hey, welcome to episode 31 of the Reflective Belt. I am Staff Sergeant Rebecca Salcedo.
And I am extremely sleepy.
That's his name. Senior Airman, extremely sleepy.
Senior Airman Jordan Garner, hello.
Hello. I'm just going to say it. This is the second time we recorded this intro because the first one, the audio decided to
be
very weird for some reason. I don't understand technology. I'm
This
probably
is
going to
why-
die once robots take over.
This is why Will Smith fought so hard in iRobot.
Yeah.
Because technology is ill sometimes.
Ew.
So,
I don't understand it. It does things when I do the exact same thing and then does something completely different. And yeah. So anyways, this is the second part of our physical therapy podcast. So the first one aired a while back. I don't remember the exact day. And we have a fantastic interview with the intelligent, bright, smart, energetic, and wonderful Capt. Jilek. She is a doctor of physical therapy at the clinic on Langley. Yes, she has lots of great information, and this kind of supports our whole initiative this year for the Year of Fitness. So what's the best way for people to just recover? What should people be doing when they're like post-surgery or something, just recovering after something, like they injured their shoulder or maybe they have a knee injury? What should they be doing during that period of where they can't really work out as hard?
Right. So, I mean, it depends on the surgery. It depends on the body part. Like if someone's recovering from like a shoulder surgery, really it's those first 4 to 6 weeks are going to be basically don't do anything. Which people don't like, especially the active people who hurt themselves being active. They don't want to hear that. Because with shoulders especially, it can be really straining to actual shoulder joint just doing movements with your legs. Like,
oh, really?
Don't do any running, really. You can't really do that because it's going to be jostling up here. Obviously, you can't really lift. You don't want to do stuff with just the one good arm because you're going to get overuse injury in the good arm. So really, it's just, hey, rest, take some time, let it heal. But it really depends on the injury. So then if you look at like a knee, it also depends on the injury there. But if someone has an ACL tear, there's some variations with rehab. But if you have an ACL tear with a meniscus tear as well, the meniscus is that cushiony part that supports the knee. If you have a meniscus tear as well, that kind of makes rehab a little bit more difficult, a little bit more time consuming in the beginning, and then you can kind of take off after 8 weeks or 5 weeks. Depends on the issue. But a straight ACL tear, you can actually move pretty quick, pretty soon afterwards. ACL rehab has come a long way. There was a time way back when people were immobilized for several months, and then they'd get contractures, meaning that the joint is actually stuck in one spot. That's no longer the protocol, which is good. But yeah, medicine for especially ACL rehab has come a long way. But overall, rest, let your body do what it needs to do. It needs to go through those phases of healing. You can't do it if you don't allow it to.
Yeah,
so
see, I would have an issue with that. Like,
like because you have to go through the inflammatory phase and the remodeling phase, and then the scars have to heal in the way that they're supposed to heal. And with arthroscopic scars, those little holes that they do for surgery, a lot of surgeries now aren't open anymore, so you don't have those huge scars anymore.
Oh, interesting.
A lot of them are arthroscopic, so even the ACLs now are being arthroscopic, which is awesome.
Wow.
So they don't have those big ACL scars that have to heal anymore. So it's the little ones. So that helps a lot too.
So it's less invasive.
Yeah, it's less invasive, and then the scar rehab can actually be kind of difficult sometimes, especially, it depends on ethnicity a lot of the time, but you can get keloid scarring.
What is that?
Where the scar kind of like bubbles up and gets out of control.
Oh, wow.
You end up having this humongous scar that sometimes even needs like revision just for the scar, which causes more inflammation, which causes more scarring.
Oh, God.
It's just a big old mess, but arthroscopies are really good.
Okay.
Yeah. So rest.
Just
Take it easy.
You
You
can
just
do
had
it.
surgery. It's okay.
Oh my god. I know
Yeah.
a lot of people have an issue with that though.
Yeah, it's hard. I understand because I've been there.
Yeah.
I think that's why I sympathize a lot with people, especially my shoulders. Love you guys. Because I understand what it feels like.
Mhm.
And it's the worst.
I bet. Thankfully,
But if
I
you
have
push
never had to
through-
do that.
Yeah, you're going to be just fine. You push through, you're determined, you do it the right way. You'll be just fine. I can do everything anybody else can do.
Mm-hmm.
Yeah, it's never even a question.
Was it one shoulder or
One
both?
shoulder.
Just one.
Yep.
Okay.
Yeah.
That's awful.
Yeah, so I'm good to go. You
Awesome.
just do it right. Yeah.
Is there anything you'd like to add? Anything you're passionate about that you want to talk about?
Doubt.
Yeah.
People carry a lot of their stress.
I
in their ne-
carry
in
it
their neck.
here.
I carry it here too. Neck injuries I see a lot as well.
What happens with the neck injuries? Like, how can people prevent that?
Yeah, so again, it's going to come down to that mid-spine. And then people actually have... I'm a victim of this as well, or I'm the worst. I have weaknesses in my posture as well. So
Mhm.
you probably see me if I'm here. I'm like...
I do that too. I'm always like
I'm like,
slunched
okay, I
over.
have to sit up a little bit higher. So it comes down to posture, and this is for lower back as well. Posture is huge, and it's difficult when you're doing work all day.
Mhm.
You're up and down from a desk, and you're tired. You just want to sit there and relax and just like
Yeah.
let yourself be. And don't get me wrong, posture is dynamic, and it's okay to slouch sometimes. But when it's like the 24/7 slouching, especially a lot of our intel guys who are like sitting in the dark for many, many hours, they can be really difficult, especially for the neck.
Those contraptions that I've seen them on Instagram,
Yeah.
do they actually work? Like the ones that go over the shoulder that pull you up? Is that effective, or is that like something stupid?
So it can be effective as like a reminder.
Mm-hmm.
And so I've actually taped some people too with like kinesio tape and to kind of get the shoulders back to kind of be as a reminder, be like, oh, if you pull here, feel the tape pulling tight,
You need to
you
sit
know
up.
you're slouching. You need to sit back up again. So I think it's best for that. Is it actually going to fix posture? No, but it can help you remind yourself to kind of start getting into the habit. One of the other issues with that is that if it's actually a support brace and not as much of a reminder, it can actually make you weaker because
you're relying
it'll
on
be
it.
supporting you.
Oh.
And that's another issue with braces in general. Sometimes you need an ankle brace, sometimes you need a knee brace. But if you keep wearing it, it's gonna start being like, it's gonna enable you and
Interesting.
make you weaker than if you had rehabbed correctly the first time.
So like people who have like the loose kneecaps, and if they wear that knee brace to kind of hold it down, is that going to make it weaker? Can they fix
It
that
could make
issue?
it weaker. Yeah. Those little sleeves honestly don't really do anything.
Okay.
You can wear it. The thing about like even some taping techniques, some wrapping techniques, they're good, but they're better as like okay, I feel better. I feel better wearing this. The research regarding them isn't really, it says it's not really effective one way or the other, but it's more of a placebo almost.
Okay.
And if it makes you feel more comfortable, then it's working. If it makes you feel like you have less pain, then it's working. Whether or not the research says it's physiologically doing anything, it's working if it makes you feel better. Like, so I'll sometimes tape someone, and I think it's going to help, but I'm like, I think this is going to make them feel more comfortable, or it's going to serve as a reminder. Like, if you see those guys in, like, the NBA with, like, their big, like, elbow sleeves.
Yeah, I was actually going to ask about that.
They don't actually do anything. They're not actually going to support the elbow. They're a nothing. But they could be using them as a reminder or to look cool. Who knows?
Don't know.
Maybe a brand name. But that's usually what they're for, is be like, okay, I know this elbow is hurt. I have a wrap on it. I need to be careful about it. And that's usually what I use that for, even for myself. If I'm feeling something's bothering me, I'll put some tape on it just so I'm more aware of it and more know to be more careful.
Okay. So what about like wrist wraps for, I'm making sure, for when people are lifting? Did those do anything? Like, does
The
this
wrist wraps
actually
can
help?
be a little bit supportive. They can be supportive. Like if you're having a lot of hyperextension issues, the wrist wraps can keep you from hyperextending too much one way or the other. So that can be good. I don't use them a whole lot, to be honest. If someone's having a lot of wrist issues, I think they need to be doing some more strengthening and some more stretching versus wearing wraps. But if you got to do what you got to do,
Yeah.
and push comes to shove, I mean, all of us are in here for the mission, obviously, and so you got to do what you got to do to get through whatever you need to do. So yeah, the wrist wraps are fine, but again, you should be figuring out, well, what's the problem?
Why is it weak?
What's the underlying issue? Like if you're having a lot of pain in your wrists when you're bench pressing, it's probably not your wrist.
What is
it?
it?
It's probably your elbow, your shoulder, or your upper body. It's
Oh,
probably a
interesting.
whole issue up the chain. So everything's super connected. Whenever I'm treating elbow, I'm almost always treating the shoulder.
Really?
Yeah. because usually it's the mechanics issue up the chain, which can come back to the spine. A lot of stuff comes back to the spine. So if I'm treating you and you're like, why are you touching my spine? My wrist hurts, because I want to make sure it's not an issue up the chain.
Interesting.
For more of like the carpal tunnel-y kind of stuff, it depends on what the cause is. Like I have several women who are pregnant right now who are having carpal tunnel.
Why?
That can be like a side effect of just like, I honestly don't even know the exact mechanics of why you get carpal tunnel from being pregnant, but I have seen it many times.
That's interesting. I think I've heard about it too.
Yeah, and I think it is more just like a compression issue, like everything's getting squished in there.
And it would affect?
It could affect brachial plexus all the way up here because ribs are moving.
Oh,
brachial
interesting.
plexus is up here, and the median nerve runs down the arm and affects carpal tunnel. So that'd be my biggest guess. I haven't actually researched it very much because I don't have very many of those patients. But I think that's probably what's going on. Maybe there's some hormone things going on too, but I see it a lot. But for people who aren't pregnant who are getting carpal tunnel, I'm looking at, is the nerve stuck somewhere? Because there's a lot of different spots that nerves can get compressed. It can get compressed in your elbow or into your shoulder and just be in between some of your muscles as well. And then it comes back to neck pain.
Ugh.
So someone's having a neck pain issue and they're having pain down the arm, and I'm thinking it's getting stuck in their neck.
Is there a way to like release that nerve?
Yeah, so there's a few different ways. So it depends on where it's starting at. Like if you have a nerve compression that's starting in the elbow, I can kind of do some elbow mobilization, some soft tissue mobilization, get that nerve a little bit loosened up. But if it's coming from the neck, that's going to be a whole other issue. So we're looking at more of like a traction therapy kind of thing, trying to get the bones to separate a little bit.
Oh, interesting.
Loosen up some of the space, because those nerves can get crunched underneath the vertebrae if there's swelling or degeneration in the spine or in the disc. So that's kind of what it comes down to for that issue, if it's coming from upper in the neck. But I was going to say something else, I don't remember. Oh yeah, so the issue with nerves, like nerve pain can sometimes feel like muscle pain, even though it's not. And the difference between nerves and muscles is that muscles are like elastic. They are like a bungee, so they can contract and they can relax. But nerves are more like floss. They're like they're one length. That's what they are. You can't push and pull them.
Oh, interesting.
You can only kind of glide them like this versus like this with like a muscle. So if a nerve is getting compressed, I can't just stretch it. There's no such thing as a nerve stretch, because it doesn't stretch.
Okay.
It can glide though, or it can glide, slide, or floss is what we call it. So sometimes I'll put on my plans of care, and we're going to do a nerve glide. And that's just getting the muscle or the nerve to move better through the structures that it naturally goes through. And so if someone has like a sciatic nerve, so people hear the term sciatica, that's usually an issue with the sciatic nerve being compressed at some point from the low back down to the foot.
Oh, interesting.
And so I can't stretch the sciatic nerve, but if you stretch the muscle, that can sometimes help loosen up the area around the sciatic nerve. Or you can do a glide where you're kind of moving your foot up and down with your head too. You're kind of gliding the nerve.
Oh, interesting.
You're just moving it more so than stretching it. Because if you try to stretch a nerve, it's going to get angry. You're going to get like a nerve injury, and it's going to get inflamed, and it's going to hurt more.
Oh, God.
Yeah, nerves don't like to be messed with.
How do people stretch nerves?
Well, you can. Or,
okay. I mean, like try.
Injury. So if you stretch, like, you can go into like a position of a glide and hold it and pull really hard, and that will actually put too much tension on the nerve. You can actually injure it. So if someone has carpal tunnel syndrome, I'll give them a median nerve glide, which looks like this. You're kind of going like this. That's gliding the nerve. But if you go this way and are pulling, you are pulling on the nerve, and you can injure it.
Oh, wow.
So if someone has a lot of pain in there, I only go really light. I only want a really light little stretch feeling, and that's all I want them to do, because they don't want to aggravate a nerve, because that's the worst.
I bet.
Yeah,
That
it's
sounds
the
awful.
worst. Yeah.
So should people be doing static stretching after they work out, or should they do it before they work out? What do you suggest for people?
Yeah, so stretching's a little bit different. So there's different ways you can stretch. You can do static stretching, dynamic, or ballistic stretching. Before working out, unless you really feel like you need it, I'd more recommend doing a stretching after you work out. Prior to working out, there's some different opinions on it, but overall, through the research, and I have a background in athletic training and exercise and conditioning as well from when I was in undergrad. We talked a lot about this. That I think of stretching beforehand as like dry stretching. That's how I think of it. It just sounds horrible.
Yeah.
So you want to do more of a dynamic or functional stretching either before. If you need to stretch before, you want to do a dynamic stretch, which means that you're moving through motions versus just pulling at your leg or something.
Okay.
And then, but more healthy-wise is going to be afterwards. You can do a static stretch afterwards. It's usually what I do at the end because you're super warm.
And so your muscles are already kind of moving.
Your muscles are already moving. Okay. So, like when people say, I'm going to warm up, you actually are warming up. Your muscles do get warmer.
Okay.
The only thing that makes muscles warmer is actually exercising and moving them. Like a hot pack will not actually make your muscles warmer. With the exception of like your feet or your hands because those are so small.
Yeah.
But like the big muscle groups, heat only goes through like a centimeter or two. It doesn't actually get into the muscles. And so if you want to actually heat up your muscles, you do actually have to work them. And so it's a true statement. It really is warm up. So you do want to warm up first and then stretch, or do your exercise and then stretch. And then ballistic stretching is just a bad thing. Don't do it at all.
What is ballistic? Oh, okay.
So ballistic stretching, ballistic stretching is like a bouncing.
Oh.
So if someone's like, oh, hold this for like a second, and then just come back and bounce like this. And like stretch. Like
so just don't do that.
If you're going to do a static stretch, hold it for a nice long time, about 30 seconds at least, I would say. And then dynamic stretching is more like moving through a motion.
Okay.
Like the full range of motion. And then for static stretching, you want to make sure that you hold the stretch long enough. I've seen a lot of people only hold stretches for like 5 seconds, which isn't effective at all. There's actually a little guy in the muscles called the Golgi tendon organ.
Sounds familiar.
Golgi tendon organ resists stretch for 6 seconds as a protective mechanism. Because if you accidentally stretch too far, this little guy will be like, oh no, don't stretch because you're going to hurt yourself. And then he'll hold on for 6 seconds. And then after 6 seconds, if you're still in that range of motion for the stretch, it'll relax and release. And then you can actually get a real muscle stretch.
So if you don't even stretch for that long, it's not doing anything. Interesting.
Yeah.
Huh. Yeah. Stretch longer, people.
Yeah. So I always like to do longer stretches. And then for anybody who actually has like a deficit with like range of motion or flexibility, long duration, low load stretching is best. So we're talking like 1 to 2 minutes.
Oh, wow.
Are our best. Some research says above 30 seconds it doesn't really make a difference. I think it does personally. But that's what I would do. Like if you really want to get your hamstrings more flexible, you want to do a nice like a long minute stretch.
Okay. After you've warmed up.
After you've warmed up.
Yeah.
Not doing your ballistic stretching.
Okay.
Do your static or dynamic stretching. Dynamic is going to be more of, you're not really trying to get more flexible. It's just you're trying to prevent injury and warm up more.
We could go on about all this all day, but we can't have
there's so
too
much.
long. Yeah.
There's so much. You could talk about anything.
We could definitely have you back.
Yeah.
Because I mean,
be back.
So I've been working on my posture. It doesn't feel natural anymore.
They make devices, like, I think we talked about it in the interview, actually. Ones that, like, help remind you to sit up straight.
Oh.
Yeah. So it's something.
That's cool. Like, because I do it myself. Like, I'll be sitting down sometimes and I realize, like, my shoulders are all the way up here to my neck.
Yeah.
And I'm just like, oh, let me, then I realize I'm, like, hunched over. I'm just like, let me, sit at attention for a second. Minus the feet being at
flatten.
Yeah.
Like, oh my God.
But I do elongate my spine every now and then just so I can have a better posture.
It's a good thing to do because we all, not all of us, but a good majority of us spend a lot of time in front of our computers, which is why my eyesight has gone bad.
Oh, no.
I was going to say something else. Oh, yeah, I hold my attention here. Which doesn't help when you sit at a desk.
Yeah.
I try to stand up every now and then.
That's why I walk around a lot, because I know while I'm sitting, my posture is horrible. Even now, I feel like even though I'm sitting up, I feel like my posture is bad because my body's so not used to having, like, being sitting up right.
Yeah.
It's just like, this doesn't feel right. I'm like, no, it is. I promise.
Right. And then the more tired you get, though, during the day, it's like, oh, this is really hard.
Yeah. This fight is I'm no longer winning this fight. I'm just going to hunch.
Yeah. So, like, comment, subscribe.
Share. Tell your mama. Tell your pa. I'm going to send you back to Arkansas. Oh.